Alright, you have just hurt your knee, or you have had major reconstructive surgery like an ACL reconstruction or total knee replacement, and lots of people, including specialists like myself, are telling you to ice the knee. But you're probably thinking, how am I meant to ice my knee? You want me to ice my knee like 10 times a day? What is the best way to do that? Would it be peas? Would it be like an ice sleeve, a cryo cuff, or something much more luxurious like a Game Ready? Well, in today's video, I'm going to explain that all to you. And for those that are new around here, I'm Tilly Milverton, an ACL and knee rehabilitation specialist, but I'm not getting all of this information from a textbook, and I didn't learn all of this information. I unfortunately have had 3 knee surgeries myself, and this is the stuff that often you can't be taught, because when you're deep in the trenches of having a really sore knee and not quite sure what to do with it, ice is a really big relief. But key giveaway, you can use ice and compression to get rid of swelling. So some icing methods, depending how you use them, can decrease swelling, but not all, i.e. a bag of peas won't decrease your swelling. I'm going to get into it in the video and explain all of that as we go along. So without further ado, let's get into it. Okay, so let's break down the options, or the options that I see people to have when it comes to icing the knee. Bag of peas, a sleeve or some kind of wraparound ice pack that you put in the freezer, a Aircast cryo cuff. This is a really old version, and I'll go into that when we come onto this topic a little bit more, or something like the Game Ready, which is an electronic device that pumps ice cold water around the knee, and it compresses the knee multiple times throughout a session or throughout the setting that you put that on. Doesn't need much maintenance in terms of you put ice in it, cold water, it goes for a very long time. But let's start with the most common one, which is a bag of peas. And you can probably see that I've put kitchen roll on my couch here, because the condensation and the water that's coming from this is often a big problem, especially for total knee replacements or any surgery, ACL surgery patients, because it gets things wet. And although we put a towel or a flannel or something in between that and our skin, obviously, so we don't get a freezer burn, frost burn, the water still manages to get out. And when you've got wounds that can't get wet, that can be a bit of a problem. But the second problem that comes with this as well is, even when it's a big bag of peas, it just sits on the knee. It doesn't wrap around. You don't get a very big coverage area. And like I said, with knee replacement and ACL surgery, you've often had a graft from somewhere else within the knee. So the back of the knee needs icing as well to help with pain. So whilst a bag of peas is really good, you would need multiple bags of peas, because they go cold quite quickly, they defrost, and they can have a tendency to get things wet, and you have no added element of compression at all with a bag of peas. So fantastic, if that's all you can manage, great, you'll need several bags, and you also need to make sure that things don't get very wet. Second one is probably the most common that I see people use, and that's a simple ice pack. Now this one is actually a MyProtein one. I got it free with an order years ago, and I mean years ago. It's very good because you can actually wrap it around and create an element of compression by wrapping that tightly around the knee. But as you can see, it's very thin. It doesn't give you a big coverage space. And once it's actually frozen, it's very firm. So you almost have to break it. Eventually it all wraps around the knee, so you get maximum coverage. But this does then create condensation, and this probably only lasts for 20 minutes. So if you were using this ice pack version, which people often do, they get them off Amazon, and you can get bigger ones, be mindful that you need to kind of have, again, 3 of these on the go to make sure that it's always cold and always frozen. But it's very good because you do get an element of compression if you put it on tight enough. And we know that when we ice the knee, we are actually icing for pain relief. Lots of people assume that if you put ice on a knee, it will reduce swelling. That is not correct, and the studies have shown us that now for several years. Actually, what we do to reduce swelling is elevation and compression. Ice helps calm the knee down. It removes that post-operative, that acuteness, that pain, and it can help us reduce the amount of opioids that we use, which a lot of people are heading towards now and not actually wanting to take those types of drugs, which is totally fair and reasonable. I would much rather opt for icing and natural methods to reduce pain over any type of highly dosed medication. So, and I'll talk a little bit more when we get to this one in terms of icing and compression and the benefits of that. But that's the standard ice pack, okay? Now this one, I actually got this given to me from the hospital when I had my first knee surgery, which must be 10 or more years ago, possibly 12 years ago now. And you can't buy this one anymore, but what you do with this one is let me change the camera angle actually, so that you guys can probably see a little bit better. Hopefully if I'm a bit closer here, this will work. But what you do with this one is you take this cap off like this, and you fill it with some water, and it kind of fills down to the back by these little lines, and then you put not ice cold ice, you put ice in it, and then what you would do is wrap it up. So put the little lid, the screw top back on, so you've got a combination of ice and cold water in here. And then how it works is you wrap it around the knee like this, and it's got this little air pump which is really, really good. And basically you can just pump air into this, and it makes it really tight and adds that element of compression within that knee joint. So my knee now feels really nice and compressed, and it technically would feel cold if there was obviously cold water and ice in there. But a really nice way to compress the knee, which we know helps with swelling, and ice the knee to reduce pain. So this one is a bit of a double whammy. Now, I know that there are new versions of this, and they come with the little machine thing, and I often see recovery hubs and stuff selling them. Personally, I don't think they're worth what people pay for them. I just don't think that the tubs stay cold enough for what you're paying and having to constantly change them. And even with this one will last cold for 20 minutes, and then I would have to put more ice and more water in it. But the benefit of this one is the fact that it doesn't condensate. You don't get any water coming out of this one. You don't get water leaking, and you get that added element of having the pump to provide compression, okay? Really good one, but again, I don't think that you can buy this type of one anymore. And the newer ones, personally, I'm just not 100% sure about. I think it's a lot of money for not a lot of value, and often people try to sell them on, but given the nature of it and the fact that it's been used and it's got random bits of hair and stuff like that on it, and then there would be no way of cleaning this hygienically and professionally and properly. I don't think you often get your money back for that type of product. So that's my opinion on those. I don't have one of those, or else I could have shown you it. But now, let's go in to the holy grail of ice machines, and that is literally the game ready, or I like to call it the game changer. I am not kidding you. This device is absolutely incredible. It comes in this insulated bag, so you hire these, and I think that you're about £100 a week to hire them, or maybe a bit less than that. And it comes in this bag which is freezer insulated, and what you do is you actually leave this device within the bag because it helps it actually stay cold and cool, and you plug it into the main so that you obviously have power, and you fill the reservoir back here with ice and water. But what I actually do, and this is a top tip that I give to my patients, and it's in my complete ACL recovery guide as well, is that those takeaway tubs that we all get from the Chinese or Indian or whatever takeaway you have, those little plasticky tubs, if you fill those with water, they freeze obviously overnight, you put 2 of those in this reservoir and it keeps it cold for probably 6 hours, maybe even more. I like it really cold when I use it, but it stays cold for so long, and you're not constantly having to replace or replenish ice, and there's no water going anywhere. So fill that up with the Chinese takeaway, Indian takeaway tubs of blocks of ice, keeps it cold for longer. Put it in the insulated bag so that it stays cold for longer as well, and it limits some of the noise, not that it's that noisy. And then you take the hose which connects to the device, and that just gets pushed in. One sec. And that just gets pushed in like that, and you'll hear a little click. And the other end actually goes into the leg cover, like so. And that's how it transmits the water, but also the compression. And then what you do is, or what you would do is, open the leg cover, and then you wrap the whole leg within this, like so, like this. Wrap it up, and as you can see, you get such a good coverage from there to there, the back of the knee, and then you would turn this device on whichever setting, normally setting 2, turn it right down to cold, and it sends ice cold water through the knee, and it continues to compress, release, compress, release. So if you're doing this with your leg elevated 6 times a day, it has a huge impact and difference on actually reducing not only pain, so post-operative pain, but also swelling, because of that key point that I made earlier. You're getting the compression and elevation and ice all within one go. This for me is by far the best device I've ever used, hired, bought, since having an ACL surgery or any knee surgery. It is just an absolute game changer. You wear it through the night. It really does reduce the post-operative pain, and I've had lots of my patients use them now that just cannot believe the difference, especially patients that perhaps had a ACL revision. They cannot believe the difference in pain reduction and swelling reduction, and their ability to do more exercises, because you do it before the exercises and you do it after the exercises. So this one for me is the absolute gold standard and the best thing. And if somebody held like a gun to my head and said, what's the #1 accessory people should have after the complete ACL recovery guide, this is, because if you haven't got a plan and you're just guessing, doesn't matter what icing you use, it's not going to go well. But second thing to that would probably be the Game Ready. Third would be the Compex muscle stem, but definitely this, because if you can reduce your swelling, reduce your pain, you can do a lot more. Your quads will work better, you know, muscle inhibition will be reduced. So that's my top icing methods, kind of top to bottom, and how I would use them, or you know, the intensity and things like that, and best set up to use them. But I hope you found this video useful. Please don't forget to subscribe and like, and leave me a comment just to let me know whether I should keep doing this. I've had some really nice emails and really nice messages from you guys to say that I've helped you on your journey and make things seem more understandable and explained in a way that is really relevant to you, which really means a lot. And I'm not saying this to get more comments to make me feel good, but it really is just to make sure that I, you know, if I'm going to keep turning up, it's giving you value, because I'm doing this for free. I'm not going to get paid from YouTube. I never will. It's just simply to float information out on the internet that people will hopefully stumble across and go, that's really helped me. That's helped me, you know, feel a bit better about this whole journey. And don't forget, for absolute more tips and tricks like this and a complete ACL recovery guide, there is my complete ACL recovery guide, which is £89 for step-by-step ACL rehab. Exactly what I do with my own patients, something that I created because I'm just that busy in clinic, and I thought there's got to be another way for me to help patients. So I spent 6 months building it out. Every exercise has video demos telling you how to do it, direct access to me for any questions or queries. And if you want to see the results from that, please check out my Instagram, because there is thousands of people now worldwide using the complete ACL recovery guide and finally having clarity and understanding their ACL rehab better. I will catch you in the next one, hopefully.